Welcome back to All the Facts. Like to apologize for the cut-in transmission. Like I said at the beginning of the video, we're in the Bundus, very poor connectivity. So I was still trying to explain the money that we're seeing on the internet. Whether this is the accurate money or not, it's debatable. It's debatable. So with the money being spent, whatever it is, whether it's half a billion, whether it's more, whether it's less, it's neither here nor there. We have far-reaching questions that we should be asking, but the truth is, there is no Cuban doctors who's here to take anyone's money. The government is willingly doing it. So our questions must be directed to our government. Our anger should be directed to our government. So the truth is, as there was a question there by asking, this is not the first time we are doing this. Yes, this is not the first time. The South African government, as I said, has been employing Cuban doctors since 1997. They signed an agreement in 1996 and they have been employing Cuban doctors since then. Cuban doctors have been playing a critical role in maintaining staff levels in rural hospitals throughout the country for the past 23 years. So, number one, why does South Africa need to go and get doctors from Cuba while there are doctors in South Africa? Well, the government is saying they are specialists. It will be nice to see the list. Out of the 187, how many of them are critical care doctors? How many of them are critical care nurses? How many of them are virologists? How many of them are epidemiologists? How many of them are pulmonologists? When the government is confronted with questions about the doctors, the government responds by saying these are specialists. They are coming to fill in the space we need. So it will be nice to see how many of them are there and go back to the issue that has been raised. Do these specialists exist in South Africa? I can tell you with utmost confidence, the province of Limpopo has one virologist in public service. She works at Mankweng Hospital. A province of 5.9 or 6 million people. One virologist. So if you say, I cannot find virologists anywhere in South Africa, I cannot find anyone available in South Africa, I need 20 virologists. Now, I cannot find virologists in South Africa. I have gone to Cuba to get them. That makes sense. No one should be able to argue with that. No one can argue with that. If you say, look at the Eastern Cape, look at Limpopo, look at Northwest, look at Mpumalanga, I have 10 critical care physicians. I cannot find them anywhere in South Africa. So I've gone to Cuba and I've gotten them. That makes sense. But even though, notwithstanding the fact that it makes sense, why do we not have them? Like I said, we have far-reaching questions that we must ask. What have our universities been doing? That means when this COVID-19 thing is done, someone has to answer some questions, some very uncomfortable questions. Universities need to tell the public where are the people they are training. Universities need to tell us why they are not training. If you look at all our universities, here and there they say, we are here to respond to the needs of Africa. We are here to respond to the need of our country. So the question is, how is it that in the 26 years of democracy, our 9 medical schools are not enough to produce the specialists that we need? So we have to ask questions about universities and the training of specialists, medical specialists in the country. This is not an easy conversation. I can tell you it's very uncomfortable. But we need to ask. In a time of crisis, we are running to Cuba to go look for specialists. What are our universities doing here? So we need to ask vice chancellors. We need, you heard the Minister of Higher Education, Dr. Blade Nzimande, the Honorable, saying they are guided by the deans what to do about medical schools. So after this COVID-19 crisis, we need to have a family meeting and ask the deans of health sciences faculties in South Africa, what are they doing? Why do we have to run to Cuba to look for doctors when they are there? So that's an uncomfortable, very uncomfortable topic, but we must deal with it so that we can find solutions. Cuba will not always be there to bail us out of trouble. The other question that has been asked is it true that South African doctors do not want to work in private? I mean, in rural areas? Well, that's a very uncomfortable topic. There is a whole society called Rural Support Network. It starts from universities all the way to a doctor's level. Its main aim is to encourage healthcare professionals to work in rural areas because, let's be honest, there are better schools for your kids in the cities. The quality of life in Johannesburg is better than where I am in the middle of nowhere in Limpopo province. So for one reason or another, people have to make difficult decisions. Marriage, you are married when you are in final year of medical school. You are not just going to leave your partner and go work in the bundus, So everyone has their own reasons why they don't work, why they don't find working in a village hospital. Yeah, interesting question. I'll come back to that. I was still saying every healthcare professional, doctors, x-ray, radiologists, everyone has a reason why they find working in the villages not attractive. The government knows that working in the villages is challenging. They appreciate the situation. That is why in the poorest provinces of Limpopo, Eastern Cape, and Mpumalanga, they even introduced some years back this thing called rural allowance. That means the government sees that working in a village is financially more demanding than working in a city. For example, the roads are bad, so you might have to change your tire more than a person working in the city. So the government has always known that doctors do not want to work in a village, you see. So they've always known that. So the question is, what have they been doing about it? And just a second. So thank you for engaging with me. I just received a very interesting picture from Mr. Unati September there. It shows how many of the specialists that the government is talking about. We will come back to point number 1, and I will make very interesting points that will answer some of the questions that have been asked. So we were still addressing the issue of why doctors find it not interesting to work in a rural area. Not just doctors, but even nurses. People leave their province and go work in Cape Town. Go there to Cape Town, you'll find nurses from Limpopo. So this problem has been long-standing. The government likes saying COVID-19 has created problems. COVID-19 has not created any problems. COVID-19 is exposing problems. You see, we cannot blame COVID-19 for exposing our problems. Access to healthcare in the villages has been a problem for many years. So the question is, what are we going to do about it? You know, I've already said doctors from South Africa can leave, from the cities can leave, go to Australia. And they go to Australia. When they leave the cities, somebody in the village leaves and go fill up their space in the city. The government chooses an easier solution. You see, when the South African government employs you in South Africa and you are from Cuba or wherever in the world, there are Ukrainian doctors in this country. You know, it's not only Cuba where we get doctors from. We get doctors from Ukraine. Do you know where Ukraine is on the map? Doesn't matter. But I'm just saying, we look everywhere to fill that space in the village. A doctor coming from Ukraine, not familiar with the map of South Africa, is not worried whether he's working in Johannesburg or in the middle of Mpumalanga. He is not familiar. He works there, he gets paid, he is happy. So he doesn't ask any questions. So it's easier for the government to fill these posts in the villages with foreign doctors. That's the cold truth. I told you that I will tell you the facts as they are. That is just how it is. When a doctor comes from Cuba and they say you are going to work in Sikororo, you don't care. You are working. The money here is better than in Cuba. So you are not interested. You saw Joburg when you came in. You got driven to Sikororo. You work there. You visit the surrounding areas of that area. You know, you go home, you see Joburg again. You are not worried about the country's map. You are not worried about the country's inequalities. But the health inequalities that we are seeing now with COVID-19 have always been there. Eastern Cape did not become a challenge for the government healthcare-wise today. The government has been making promises to the people of Eastern Cape since the beginning of time. So the people of Eastern Cape have to ask, kuzoba nini when their problems are being attended to? The fourth point that was raised with regards to the Cuban deployment speaks to unemployed nurses. It speaks to yeah, thanks for the joke. It's past 11, so thanks for the humor. Somebody saying Ukraine doctors don't want Uber Eats. Thanks for the humor. It's 23, it's past gone 23 hours. So yeah, people are on lockdown, you know, probably slept during the day. So thanks for tuning in and thanks for the humor. Let's continue. Unemployed nurses. Dinosa was on TV saying, wait a minute, you government have money. You have 500 million. Hold on. For the past couple of years, the government spent millions. Okay? Remember I said, let's take it back a little bit. You know, history is fascinating. The government acknowledges that it needs to train doctors and it can't train them in South Africa, spends millions sending them to Cuba. I don't know what the bill is for the past 23 years, but it's not less than a few billions. We have spent a few billions sending students to Cuba. We have also spent more billions here in South Africa sending students to medical school, nurses to nursing school. So the government acknowledges that there is a problem and they're trying to solve it. Here is the downturn. I went to medical school with a provincial bursary. I came back straight to Polokwane and worked there and went straight to the Bundus. They say, we pay for 6 years of medical school, you are obliged to work for 6 years. Here's the fun facts. Last year, the Department of Health Limpopo released all their students, those who had just finished ComServe, those that we call post-ComServe, because they didn't have the money to hire them. You have millions to send people to school for 6 years, 7 years, sometimes longer. It's very hard there in school, Doesn't necessarily take 6 years, can take longer, and they pay. And this person today is a doctor, is working in the province, and you give them a letter that say, look, if you want to leave, you can leave. Please leave. You are released from your obligation of saving your 6 years of the bursary because we don't have money to employ you. The same applies to nurses. You see, it applies to nurses. Last year, the MEC was at court with nurses who were trying to force her to employ them. And she just got there to court and said, Treasury says there is no money to employ anyone. So there's nothing we can do. So those nurses trained by the government money, by the Department of Limpopo, cannot be employed in Limpopo because there is no money at Treasury. There are posts. Don't get it wrong. There are posts. The posts are frozen. So another difficult conversation we need to have. Remember, 2 weeks ago, we spoke about staff feelings at staff levels in public sectors. And we said that schools do not have the number of teachers that they should be having. The police are short. Doctors are short. Nurses are short. The posts exist. But since Treasury says there is no money, the posts are frozen and people are not employed. So that is what the NOSA is fighting about. The NOSA is saying, how do you allegedly have 500 million rands to bring in 217 or 187 doctors for a mere 12 months, but you don't have money to employ nurses. Nurses that you paid 4 years for in nursing school. You don't have money to employ doctors that you paid a minimum of 6 years for in school. It sounds counterproductive. It sounds contradictory. It sounds like we are not sure what we are trying to do. The problem still exists. Remember, I said the bursaries are intended to solve staff shortage problems in the rural areas. You see, when it's very easy, if you get to medical school or you get to nursing school and you are from the village, it is proven that a student from a village, is more likely after completing their studies to go and work in a village. There are studies that proves that. Those studies inform the department. They are informing the department on how to give out bursaries. So more village students get bursaries. You see. Unfortunately, nurses have to go to other provinces and look for work. Even now, some people are very angry. Imagine you had a bursary, you went to school, you came back, you did 1 year community service as a nurse, you are told you can't be employed. Jiggy jiggy, there's COVID-19 and you are told that they will employ you for 1 year only. Once the virus is defeated, you go back to being unemployed. That sounds evil. Okay? You cannot employ me to only fight a virus, and after the virus you fire me. That sounds evil. Okay? So a lot of nurses are not interested. They want to be employed permanent. I say they should be employed permanent. You see? Let's learn lesson from New York City, New York State. At the beginning of the COVID-19 fight, you remember New York has more cases than any country, of COVID-19. It's very bad over there. Governor Andrew Cuomo said, we are going to employ additional doctors. We are going to employ additional ventilator technicians. We are going to employ... So, to solve the medical personnel problem in New York, this is what they did. The U.S. Army deployed 1,000 people. Doctors, nurses, and most importantly, ventilator technicians, VTs. On top of that, the New York State said anyone who lives in the New York State and is a healthcare professional and want to come back to work, enlist your name. You see, enlist your names. More than 70,000 people, came forward and said, we are nurses, we are doctors, we are retired, we are working in private, we have closed, we are available, we want to help. Out of that 70,000 plus, the state of New York employed around 6,000 plus of them. A reporter asked the governor, Andrew Cuomo, how are you going to pay for this? And he said, look, do we need them? Yes. Are they important? Yes. So we will figure out the money. If it's something that we believe we have to do it, we will figure out the money. So people are asking, why is South Africa jumping the gun? Is South Africa jumping the gun? Yes. For me, the government just want to be seen as turning all the stones to fight the virus. In their own statistics, which I have a different opinion of, expressed else in other videos, they are saying we are flattening the curve. I only see a rising curve and insufficient tests being conducted. Nevertheless, in their own words, they are saying we are flattening the curve. Why do we need to bring in doctors from Cuba if we are flattening the curve? Like I said, conflicting policies. It is the same energy, the same minds that give people bursaries and not employ them. And when they have problems, they don't employ those people that they refuse to employ even though they gave bursaries. Instead, they run to Cuba. It's always an easier decision for the government to run to Cuba. It's an easier decision for them. I don't know why, but it looks easier than dealing with the problems at home. Because here at home, Cuban doctors will come for a year and they'll leave. Here at home, you employ me, I'm working in private. I might decide that, you know what, I like it here in government, so I'm going to stay. So that's why people do not want part-time posts. But also, doctors in private have not said they want permanent posts. The doctors and nurses who want permanent posts are the bursary holders that the department paid for bursaries and did not employ. And by the way, that's not a big number. If the government want to afford it, they can afford it. The same way that they're affording the Cuban doctors. So that's why I said, this is not about the Cuban doctors. It's about our government's haphazard and conflicting policies and decisions that are seemingly rushed and not necessarily well thought. Doctors in private are saying they are available to work on a part-time basis, to work on a short-term basis, to help. They are saying they have not been consulted. So there you have it. They have not been consulted. The South African Medical Association is saying they have not been consulted. So we don't know how many retired doctors we have in South Africa and how many of them are willing to come and assist. We don't know how many doctors are working in private and are available to assist. What we know is that the government sat somewhere, discussed and said, we are going to Cuba to get doctors. You ask me, I'll say the government want to be seen as turning every stone, doing everything. Well, there's a problem with doing everything. How do you assess what is working and what is not? This is a moving target. This is a marathon. It's not a sprint. So you cannot have a lockdown today before you even assess whether the lockdown is working. You are doing something else. So let's go back to that first question. Just pardon me for a second while I copy this. So family physicians is 2. Public health specialists is 11. Epidemiologists is 18. Very important subject of biostatistics is 21. Family physicians is 105. The 2 is actually biotechnologist. Health technology is 30. So this is the breakdown. This is from the NICD saying where Cuban brigade will be dispatched, and showing the provinces where they will be going to, dividing them through. But anyway, for our discussion, is the totals. So no virologists, okay? No critical care nurses, okay? No critical care physicians, okay? No pulmonologists, okay? So who is this 187 people? It's family physicians. What do family physicians do? Health promotion and community medicine at the community level. That's important. But did we need to go to Cuba? Let's take, for example, the Department of Health Limpopo is saying they have screened 2.7 million people. That's more than 50% of the population of Limpopo without help from any other province. They did that by themselves. So, no, we don't need family physicians from Cuba. Not necessarily so. What we need to be spending money on is getting the virologists who are sitting in private. They must be working in public for the time being. What we need is to be incorporating testing capacity and capabilities. By the way, under a state of emergency, both public labs and private labs will have to work together. That is what we need. The Minister of Health said he wants to test 36,000 people a day. The 500 million he is using on Cuban doctors is not going to help him test 36,000 people. So if you ask me, 500 million would go a very, very long way towards improving testing. I do not see. The minister said we have 30 critically ill COVID-19 patients and 15 of them are on ventilators. So we actually we have this under control. The 15 patients who are on ventilators, we have enough doctors for them in the public sector. We have enough critical nurses for them. So we are not at a crisis where we should be getting help from elsewhere at what seems exorbitant price. Biostatistics 21, these are people who count the disease. Well, I don't know how many biostatisticians we have, but I don't know if a country that is economically junk should be spending money on that. Health technology, I don't know if that is what they are doing, what they do. It sounds like, I don't know if they are ventilator technicians. Like I said, the US Army deployed ventilator technicians. So I don't know if these 30 people will be helping with maintaining ventilators. The government has spoken about something about repairing medical equipment. Well, why do you need to spend 500 million? How many medical equipments can 500 million buy? Remember we did basic mathematics the other day when MEC of Health in Gauteng said he wants 1,500 ventilators for Gauteng. I said a ventilator costs 25,000 US dollars at 19 rands to the dollar. Today it's 18 rand something, but at 19 rands to the dollar, 1,500 ventilators comes to around 670 million. So with 500 million divided by, you can do the math there, we can buy around 1,300 ventilators. The hospital I work in has one ventilator. So that ventilator is not going to be used for corona patients. That ventilator will be used, for non-corona patients, because it's one. If we use it for a corona patient, it becomes contaminated. So we can do with the ventilator. 500 million can buy 1,300 ventilators. By the way, how much money have they put aside for? Hello? Are we still live? Just wave if we are still live. Village network, guys. It's very sad, So that's one of the reasons doctors and nurses don't want to work in the villages. The network is very bad. All your data is